Hi, my name is Yarisa, and this is my speech on universal healthcare. This is my audience. We've all heard those jokes from other countries, specifically Europeans, about how our US healthcare system sucks. They are usually shocked at how much an ambulance costs or how much regular care would cost. And we've also probably heard about how people receiving their itemized bills see that $20 for a Band-Aid they've been charged. And that brings me to questions. Why does the system exist, and why does it have to be like this? Well, I believe that the US should have universal health care. The current system is flawed and it harms more than it helps, with many people having to pay way over what they can afford. The problem is large, expensive costs of care, and it is a result of the long-established industry and as well as misconceptions regarding healthcare. And the solution would be its implementation of the universal healthcare. Many people don't have insurance, which leaves them disadvantaged to seek care, as it makes care more expensive. Even with insurance, according to Robert Schmerling's 2021 article, Is Our Healthcare System Broken? Americans spend more money out of pocket than people in other countries. The cost is also going up. According to the MediFind article, 8 major problems with US healthcare system today. A C-section is about $15,000, which is double the amount of Australia's cost in 2017. And since then, it has gone up to $25,000 today. Recently, COVID-19 brought to light these healthcare issues and made them more evident. In a 2022 research article, Universal Healthcare as Pandemic Preparedness, one of the many authors, Galvani, highlights the ineffective system that prevented more lives from being saved. Many people were uninsured or had low coverage, which prevented them from seeking the care that they needed or seeking care in general, since they had less coverage in the first place. About 9.2% of Americans are without insurance in 2021, according to Nathan Paulus's article, The U.S. Healthcare System, which translates to about 30 million people today, which is a lot. Expensive healthcare can ultimately lead to death, which is the most extreme result. Small health issues can get worse when left untreated, and life-saving medication like insulin costs is way too expensive for people to afford, which is close to $1,000, which is not affordable. Not to mention the costly hospital bills that are oftentimes added on top of already existing bills like electricity and rent, which can lead to financial ruin. According to the study, Consequences of Lack of Health Insurance on Health and Earnings by Jack Hadley, he mentions that poor health insurance equals less hours, which as a result contributes to fewer annual earnings. So not only are you losing money by paying, but you're not making as much as you would. Now you may be wondering, what is the cause of this healthcare system and why do we still have it? Well, the healthcare system goes back to the Civil War, so it's been long established since then with the building of these hospitals for soldiers, and it eventually developed into the system we know of today. According to the article Understanding U.S. Healthcare System, author Elizabeth Cumming mentions how Medicare and Medicaid were put into place to cover people under the poverty line and elderly, which leaves a large gap of people who are uninsured. Attempts to create a system similar to universal healthcare has been shut down. In 1912, President Theodore Roosevelt proposed something similar, but it was shot down by both parties. And in 1949, President Truman did the same thing and was once again shot down. The dislike of government involvement, which is the conservative ideal, is also a part to play in why universal healthcare has not been implemented. Conservatives dislike government involvement, which universal healthcare would be considered invasive in that sense. In the blog from Mint Life, What is Universal Healthcare? There are cons listed as longer wait times, increasing government budget, which as a result would increase taxes, which is also universally disliked by people, which makes it unpopular to an extent. With these problems in mind, what is the solution? Well, on the federal level, universal healthcare implemented would equal lower costs of care and medication. In the journal Universal Healthcare in the USA, A Healthy Debate, authors Zeef, Kerr, Moore, and Stoner suggest that our system should be modeled after already existing successful systems, and goes to mention Germany, which would put these doubts to rest about the implementation of universal healthcare. On the local level, it would help to vote in politicians who share the ideal of universal healthcare so that they get the discussion going and there gets progress made on this discussion. On the personal level, it helps to bring in attention to this issue so that politicians that are already in place know that we as Americans want this issue solved and we want universal health care implemented. Universal health care is a program that would benefit many and that the United States needs. The problem starts with pricey care, which people can't afford, and it is caused by a long-standing institution as well as misconceptions of the implementation of healthcare. To solve the problem, people need to bring attention to this issue that they want it solved, as well as voting, which would bring in like-minded politicians to solve this issue, as well as later on the implementation of this issue of universal healthcare. As much as I hate to admit, those comments from other countries about how the US healthcare system sucks are correct, but it doesn't always have to be this way. Eventually, I hope to see that we have universal healthcare implemented and that it is beneficial to all. Thank you.